Hi there and welcome to part 2 of this month's Team Brief podcast. In this section we take a look at our performance figures. In December there were no avoidable cases of C. diff due to lapses in care, which brings our year-to-date total to 17, well under our maximum standard of 51. This is a fantastic achievement. It shows our commitment to delivering the highest standards of care, even when the hospitals are busier than usual. That's something that we should be very proud of. In December, we achieved a great result in terms of patients at high risk of a mini stroke receiving treatment within 24 hours, which again is a fantastic achievement. We also achieved our target for harm-free care, and that looks at things like inpatient falls, pressure ulcers, blood clots and catheter-associated urinary tract infections. Unfortunately, we only achieved 5 of the 9 key standards for cancer patients in December. Our capacity pressures caused some delays for patients awaiting planned procedures, and a number of patients opted to defer starting their chemotherapy and radiotherapy until after Christmas. Treatment of some cancer patients has taken longer than average due to the complexity of their condition. It's really important that we prioritise treatment of cancer patients, and we'll be working together to schedule procedures and diagnostics to minimise delays. In December, we did manage to achieve both standards to complete treatment for our patients within 18 weeks. This is an excellent performance given how busy our hospitals are. However, the number of patients who've been waiting more than 18 weeks has continued to grow during the year because the hospitals have been so busy. So we've arranged for some of our patients to receive their procedures and treatments in other local hospitals and facilities so that their care isn't unduly delayed. Unfortunately, because the hospitals are just so busy, we have missed our target for emergency department patients being admitted or discharged within 4 hours. Last year, we saw around 350 more patients every month than the year before. And in November and December, 1,128 more patients attended the emergency department than the same period in the year before. So despite the emergency department team's best efforts and continued commitment, the ongoing capacity pressure causes delays in transferring patients to wards and assessment areas. And when the department bays are full, new arrivals also experience delays. This standard is very much affected by hospital capacity pressure and patient flow, so making sure patients are discharged from hospital promptly creates space and resources for new admissions. The new facilities at Avondale mentioned in last month's team brief will help in the short and medium term, and work to redesign urgent care and prevent ill health should have an effect in the longer term. In December, we achieved great results in terms of patient satisfaction. The Friends and Family Test has recently been introduced in the outpatient and day case departments too. 89.1% of day case patients and 89.5% of outpatients who completed this Friends and Family Test said that they would recommend our hospitals. So we're analysing this information along with more detailed feedback that we receive via the EQIP tracker to identify trends and potential issues so that we can continuously improve patient experience. Okay, so that's the end of part 2. Please click on the link to watch the third and final part of the podcast, which includes a message from our nursing director.